broadcast. Today, Dr. Ted Harrison from Rejuvicare asked us questions about the treatment of arthritis of the knee. Dr. Harrison, a lot of people have knee pain. What causes knee pain?
Almost always it's osteoarthritis that causes chronic knee pain. This may be because of an injury you had sometime in the past, or repetitive stress from work or sports, or maybe just wear and tear from age. It adds up over time. So eventually your ligaments, they get a little loose and your tendons a little wobbly, and that starts your cartilage to erode.
Well, what can you do about that?
Well, by the time you come to us, usually you've already tried the main first line things, which would be pain medications, physical therapy, maybe even steroid injections. But these are all pretty much short-term solutions. They help in the first maybe few months, but they don't really do anything about the underlying problem, which is the loose ligaments and tendons.
So that means it'll just continue to get worse?
Yeah, eventually you would just progress and need to have a knee replacement.
Is there anything else that could be done then?
Well, we found that prolotherapy is very helpful for most patients with knee osteoarthritis, even people who have been told by their doctor that they need to have a knee replacement operation already. It's no miracle cure, but we found that the symptomatic relief that people can get from prolotherapy is frequently enough to indefinitely put off operation.
Well, what exactly is prolotherapy?
Well, it's complicated, and we have a whole nother video which we'd encourage you to watch, which goes into the details of prolotherapy. But basically, we inject solutions into the knee which stimulate the healing process. These solutions cause your own stem cells to migrate to the area of the knee where they start to work building up the tendons and the ligaments and the cartilage. And in effect, they rebuild your knee.
Well, how long would I expect to wait to see results from this prolotherapy?
The healing process takes time, usually about 4 to 6 weeks. So at the end of that time, we would reevaluate and see if more treatment was necessary.
Oh, okay. So how many treatments does it take?
Well, it all depends. It depends on your immune system, how healthy it is, and how bad the arthritis is. In general, however, it takes maybe 2 or 3 treatments to get really good results.
Okay. So how long does it last? Would someone have to keep coming back again and again for more treatments?
Well, for a fair number of people, it's a permanent cure. But you will continue to age, and so there will be continuing stress and wear and tear on the joint. So a number of people come back every 2 or 3 years, say, for tune-ups to keep their joint in shape, whenever they feel like it.
Okay. Well, are there any side effects? Would a patient be disabled, for example, or unable to work?
There are virtually no side effects from prolotherapy. Most people can go straight back to normal activities on the day that they have the procedure. Occasionally, someone will have a little flare-up of pain in the joint in the day or two afterwards, but that's pretty short-lived. Of course, you can't expect to go out dancing or play basketball immediately. That'll come later.
Well, how long does the procedure take?
Depending on how complex a particular case is, it could take from 1 to 2 hours.
Is there any kind of person who can't or shouldn't have prolotherapy?
Well, prolotherapy depends on your immune system to work. So people who have weak or overly stressed immune systems frequently don't get a good response to prolotherapy. That boils down to usually smokers and people with cancer.
Good to know. So where can somebody from this area, that is, the Olympic Peninsula, our area, get prolotherapy treatment?
They can just call our office, the Rejuvicare office, at 360-504-2260. Or they can go to our website and request an appointment from the form that's on the website at rejuvicare.org.
Thank you, Dr. Harrison.